Hello, everyone. We're excited to welcome you today to our webinar presented by Adoptive Kids on developing and supporting adoptive, foster, and kinship families. I am Mary Boo. I'm the manager of the Adoptive Kids Family Support Team, and I'm joined today by Alicia Groh, who's a consultant with the Adoptive Kids Capacity Building and Engagement Team. Before we get into the details of the conversation, I want to go over a few housekeeping items. First of all, the webinar will be 90 minutes long, and we'll have time at the end for you to ask questions using the chat feature in your GoToTraining toolbar. And we really hope that you'll help this be interactive with us. We have a few opportunities for you to weigh in how you might make some differences in your community. We have some polls to participate in, so we'll hope you'll participate as much as you can and try to keep this interactive. We will be recording the webinar, and we'll post the recording on the Adoptive Kids website so you can view it again or share it with others if you found something valuable in it. Everyone is muted during the webinar, but again, the chat feature is the best way to reach us. If you have a technical question or something you want to keep private, you can chat just to the organizers. Otherwise, if you have questions or are going to respond to any of the interactive items we bring up, you can just chat to the entire group. And if you don't know, this is what your GoToTraining control panel looks like. It shows you that you're muted. The materials are items that you can download and use later, and we'll go over what those are toward the end of the webinar. And here's where the chat feature is, where you can type your messages to us, and you can choose who's going to. With that said, housekeeping, I'll go over about Adopt US Kids. Adopt US Kids, many of you may know, is a federally funded project. It's through a cooperative agreement with the Children's Bureau at the U.S. Department of Health and Human Services. And our mission is to raise public awareness about the need for foster adoptive families for children in the public child welfare system, and to help states, territories, and tribes recruit, engage, develop, and support foster and adoptive families. And we do that through a number of areas of work. Most of you are probably familiar with the two most public-facing pieces of Adopt US Kids. One is the You Don't Have to Be Perfect to Be a Perfect Parent ad campaign. We partner with the Ad Council on that, and ads run in all sorts of media to help people understand that children need a family to care for them. We also have a national photo listing with about 5,000 children and teens waiting to be adopted. But there are other things that Adopt US Kids does well, including things like this webinar. We seek to build the capacity of states, territories, and tribes in areas that will ensure children have families and families have support. We provide information and support directly to prospective adoptive and foster parents across the country who respond to the ad campaign or other efforts seeking families for children. And we have a new minority professional leadership development program, which we'll talk a little bit more about at the end. But we hope you check out the adoptuskids.org website and learn more about what we do and how we can help you do better at finding families for children and supporting those families. I am going to turn it over now to my co-presenter, Alicia Groh, and we'll get started.
Thanks, Mary. So as Mary mentioned, I'm Alicia Groh. I'm a consultant with the Capacity Building and Engagement Team at Adopt US Kids, and I want to thank you for joining us for this webinar today. Just quickly, I want to go over our agenda to give you a sense of what we're going to cover, and then we'll get right into the real content for today. We just heard briefly from Mary about the Adopt US Kids project. We'll also go over the goals for this webinar. And we're going to cover information on the value of taking a developing and supporting families approach. We'll talk more about that in just a minute. Then we're going to cover some ideas and key qualities for effective response systems. Then we'll be covering various types of support services for foster, adoptive, and kinship families. We'll talk a bit about ways to connect early development and support to ongoing support for families. We'll have the question and answer period, as Mary mentioned, so we can respond to your questions that you submit throughout the webinar. And then at the end, we want to highlight some ways that we can help and some resources that are available to you. So for the goals for this webinar, we have several, and we hope that they really fit with how you do your work and what you're looking to learn. First, we want to help you understand the value of and specific strategies for active development and support of foster, adoptive, and kinship families from the beginning of your interaction and engagement with those families. We are aiming to highlight specific strategies and examples of programs from around the country for ways to develop and support families. We want to help you identify things that you can do specifically in your community and in your child welfare system, including applying some of these existing ideas from other programs and thinking about how to adapt them. And we're hoping that we can help you learn about specific assistance and resources available from Adoptive Kids. So to get into this topic about the value of developing and supporting families, first I want to highlight this idea that we've really been talking as a project about shifting as a field from the idea of retaining families to doing active development and support for families. And so we think of that as a way of how to help them build their skills, really starting from your first point of contact with families. So looking at from their first inquiry all the way through licensure and then long after post-placement, how can you keep developing and supporting them? And there are a lot of benefits to doing this. There's a lot of value both for your child welfare system and for the families and ultimately for the children that we're all serving. First, this approach really does help ensure that children's needs are getting met. We ensure that we're developing foster, adoptive, and kinship families who are prepared to meet the needs of children throughout the course of time that they're parenting those children. So knowing that the children may change, the children's needs may change, this kind of development and support can really help. Another benefit is that this approach increases families' skills as well as their competence and comfort in knowing how to meet children's needs and their confidence and comfort in being able to access and reach out to support systems, whether that's informal or formal or both. So it helps those families know what they can do, how they can get assistance, how they can keep learning, and giving them that confidence really helps them better meet their family's needs, including the needs of the children they're parenting. This approach also really helps with agencies keeping families engaged and building that relationship between your foster, adoptive, and kinship families and your organization. And that helps in a lot of ways, but it also means that you have this pool of available, well-prepared families to be placement resources and permanency resources for children in foster care. And although this webinar is not focused on recruitment, we really want to highlight the fact that this approach really does help with your recruitment needs because the power of word of mouth really comes into play for recruitment. And so as you have families who are being well-developed, well-prepared, and well-supported, they're telling others about their positive experience, and this helps you recruit additional families who are interested in partnering with you. So I want to do a poll question here for all of you. This is our first chance to get a little more interaction from all of you. So let's see here. First, we want to say, let's see if I can pull this up. Is your child welfare system currently providing support to foster, adoptive, and kinship families? And we're asking about whether you do that before licensure, before placement of a child with a family, after placement. It can be, you can select all that apply here. So we'll give you a minute to respond, and I will show the results once we've gotten some responses in. So thank you all for responding, for those of you who have. And if you don't know what the answer is in your child welfare system, that's certainly fine to select I don't know. All right, we've got most of you have responded here, it looks like. So I'm going to go ahead and close the poll. And here you can see the results. So it looks like many of your child welfare systems, 82%, are providing support after placement, and many of you are doing support both before licensure and before placement. So it's great to see that there's that whole continuum of support. It's good to see that no one had an answer of no, so all of your systems are providing some sort of support to families of yours, with 7% of you being not sure, which is certainly fine. So we'll go back in here. And then since we got that first test run of the poll, let's do our next poll question for you. We're curious about what approaches you're using for your response system in your child welfare system. So by response system, we really are talking about the way you are responding to inquiries from prospective parents. We're wondering what kind of structure you have or what approaches you're using. So if you are familiar with how your system is structured for responses, please answer this. If you don't know, if that's not related to your role, that's fine too. You can select any or all that apply here. So if you have a centralized intake in your public agency, or a centralized intake in a private agency that you may have contracted out, or decentralized intake at county or regional levels, those are some of those options. And then we also have the option for whether you're using experienced parents or caregivers to respond to inquiries. We'll give this a little bit more time. We've got several people have responded. And we realize that these options are not all of the possible structures or approaches that you could use for your response system. So we want to acknowledge that there are lots of other ways you can manage how you're responding to prospective parents. All right, let me go ahead and close that and show you the results. So it looks like many of you, almost half of the respondents, have centralized intake in a public agency, and a significant percentage there, 41%, have centralized intake probably through a contracted arrangement with a private agency partner. And then several have the decentralized intake. And 3% of you are using experienced parents or caregivers to respond to inquiries. That's good to see that that's being used by some of the systems out there. We know that that's an area that many places are interested in using as a way to really help engage and move prospective parents through the process. All right. So as we're talking about response systems, as I mentioned, really a response system is the way to think about how you're responding to prospective foster, adoptive, and kinship families. And really, I like to think of a response system as being, it's the way that you welcome people into your system, welcome prospective parents, and begin that conversation and that relationship. So a key part of this active development and support of prospective parents that we've been talking about really starts with your response system and the messages and the experiences that families get at that initial stage. So we've seen in our work with child welfare systems across many states and tribes and counties, we've seen a variety of response systems and structures, but we really see some key qualities that are present in effective response systems. We want to highlight a few of those here. One is that these response systems that are really effective, they're accessible and engaging. And so that means there are multiple ways that prospective parents can reach out to a child welfare system, whether that's by phone or email or a website. Some systems are using social media options to get in touch with, for prospective parents to get in touch with child welfare systems. So it's accessible both in terms of forms of communication, but also hours that staff are available, and the different formats for that kind of contact, and that they're engaging, that there is a welcoming message and tone, that people who are working on the response system are thanking people for calling and expressing their interest. So they're drawing those parents in early on. Another key quality of effective response systems is that they're supportive. And we think a key piece there is about helping prospective parents begin this process of having a conversation or an exploration with the child welfare system about children in foster care, about foster, adoptive, or kinship parenting, really helping that feel safe and supportive, recognizing that people are at all different points in their knowledge base and their learning about the process and about who the children are who are in foster care. Another key quality is that these systems are data-driven, and we highlight that as a really important value throughout child welfare systems. But in a response system, one of the ways that can really take shape is that a child welfare system can be looking at your own data on who are the children in foster care, who are the children waiting to be adopted, what are their ages, are they in sibling groups, where within your jurisdiction do they live, is it a certain part of the state or county or tribe, and being able to share that data with prospective parents at an appropriate level so that you're helping give prospective parents a sense of who are the children in care, how many families are you looking for to recruit, what percentage of children get reunified, so that all of these things can help really use more concrete data to help inform prospective parents about both the process and the specific children and their needs. Another key quality is that the system have consistent messaging, and we mean this in a couple of ways. In one part, we mean that it's consistent in terms of messaging across staff. So if someone calls gets one person on the phone to inquire about becoming a foster parent, they're getting the same kind of information and consistent overall message as if they reached someone else by phone. It doesn't mean it has to be scripted and overly formal, but just that there's consistency so that the message going out to the community is consistent across staff and across members of the team about what are the expectations, who are the children in need of placements, all of those things. We also mean this consistent messaging in terms of consistency with the rest of the part of the process for becoming a foster, adoptive, or kinship family. So making sure that your response system is informing parents early on about licensing or approval requirements, and that that's accurate and consistent information with what they'll hear at, say, an orientation session or at a training session. That kind of consistency really helps build trust and helps build the relationship between the child welfare system and the prospective parents, so parents know that they can rely on the information that they're getting at various points. Another key quality here is having feedback loops with the development and support work that your child welfare system is doing. And by this, we really mean that there's a connection in all directions between what the response system is doing, what we're telling prospective parents about what kind of family preparation and development and support services will be available to them throughout the process. So there's a feedback loop in that way. But that there's also a feedback loop so that people in your response system who are getting calls from prospective parents, you're sharing the themes and the emerging questions that you're hearing from prospective parents, sharing them with the staff who work on family preparation and development and support, so that they can prepare for, maybe there are new concerns coming up among prospective parents about children's use of social media, or other trends that may come up in the topics or patterns. Having those feedback loops within your whole system really helps strengthen each part. And then, as we've been saying already in this webinar, a key part of the response system is that it begins developing families. And really what we mean by that at this point is helping prospective parents learn more, as I've said, about who the children in care are, what their needs are, what the process is for becoming approved or licensed, what the impact of trauma is on children and what that might mean for foster, adoptive, kinship caregivers. And this development piece at this stage in the response system can really help prospective parents continue or go deeper in their own self-assessment of whether this is a good fit for them and if they want to proceed with the next step in the process. So looking at some specific strategies, because I know that was a little bit high level in terms of qualities of a response system, I want to highlight a few a little bit more detailed ideas for how you can really engage families in your response system and really think about how to weave this into your work. So one key idea here is to think about how to make your response system really fit within your overall child welfare system. As we've said, we recognize that child welfare systems have very diverse structures. They may be state administered, they may be county administered, they may be tribal services both on and off a reservation. There may be a lot of privatization in your system. So it's important to think about how your whole system, your whole child welfare system is structured, and both geographically and across agencies or departments, and then think about what makes sense for your response system. So if most of your child welfare work is dispersed geographically, if you have more local offices or regional offices, you could think about whether it makes sense to have your response system have local staff responding to prospective parents in their area, or if that doesn't fit. But I think those are the kind of things to really consider in terms of matching your response system to really align and fit with your overall structure. Even if you're looking at borrowing ideas for response systems from other child welfare jurisdictions, there may be things that you'd want to adjust to really fit what works for you. Another key piece here, strategy to think about, is really actively thinking about how your response system can be a way that you start building that relationship with prospective parents, and really seeing that initial conversation or email exchange or in-person interaction as a chance to start that relationship building, and that you're really setting the tone for how you and your colleagues and all of the child welfare system will support the family through their process of becoming a foster adoptive parent, or their process to decide that it's not a right fit for them or not a right fit right now. So if you view it as a relationship building approach, more so than just getting the information about who the person is or having them fill out a form, that can really shift the approach and the dynamic for your response system. Another key thing to do here in the response system stage is to think about how you can share clear information. And this is really, this is both simple and hard to do. So thinking about what is the information that prospective parents may need, and recognizing that they're probably all along a continuum in terms of familiarity with foster care and adoption and kinship care, understanding of what the requirements are. So it's helpful to remember that they may have been thinking about this for a long time, or they may just be starting out learning about foster parenting or adoption, kinship care, who the children in care are. So think about how to share clear information and really be able to adjust what you're sharing based on, the questions they're asking. They may need some more introductory information first, and then help them understand more about who the children in care are, what the process is for engaging with the child welfare system. One example that I wanted to highlight here, from a real example from the field, there was a county in California that saw many prospective parents dropping out of the process or stepping back from the process after their initial inquiry. And the county really wanted to figure out, how can we help move families through the process and not lose them in this process if they really are interested in continuing. And the initial feedback that the county got was that the paperwork and the administrative steps were sort of daunting. So in trying to approach that and solve that challenge, the county put in place dedicated staff positions, sort of liaison positions, to help prospective parents understand the application forms and the paperwork they needed to provide and prepare for the home study, all of those pieces, thinking that it was really sort of just an encouragement and a helping explain some of the steps in the process, that would help move families through. And that really was helpful, as the families reported. But what these liaison positions found and heard was that equally, if not more important to the families, was having that kind of emotional support and encouragement as families were thinking through their own questions and maybe doubts and wanting to make sure that they could meet the needs of children in care. So this helped address really both these the building the relationship and sharing clear information strategies. This county had these positions that really helped parents both understand the process and the requirements, but also built the relationship where it was safer for prospective parents to say, I'm worried about this, I'm not sure what ages of children I could parent, whatever their hesitations might be. It helped those families self-assess and decide whether to move forward or not, but it made sure that it wasn't a paperwork hurdle that was keeping families from moving forward. So some more strategies here and specific ideas for ways to really engage families. and I've touched on this a bit already, but I think it's helpful to think about how you can start developing families' understanding of who the children in care are, what their needs and strengths are, and what available supports and trainings and learning opportunities there are. So as you are thinking about what information to share with families, it's not just about what are the licensing requirements or what are the time frames, but it's also really who are these children that we need placements for and permanent families for, and right alongside that, what support is available to help parents be able to meet those children's needs. Closely related to that is this idea of connecting families to support early on. And Mary's going to talk in a little bit about specific ways to provide support to families, especially after placement. But we also want to highlight this idea of connecting families early on to support as they go through their licensure or approval process. And that can be support to help them through that process, as I mentioned, with sort of the liaison role, but it can also be really connecting them with other groups and with peers. So it could be a while you wait group for prospective parents who are waiting either to be licensed or approved, or who've been through that step and are waiting to have a child placed with them. It can also take the form of connecting families to existing experienced families, foster, adoptive, and kinship families, so that they can learn more about the real world experiences, as well as helping them build those connections to support groups, peer connections, respite connections. So helping build that connection early on can help set families up for success getting support in the long run. Another idea that I certainly mentioned in some of these other points, but it's important to encourage families to do this self-assessment. So this is about empowering families to understand how they can think about and explore whether foster, adoptive, or kinship caregiving is the right fit for them right now, helping them think through what are their strengths, what more information would they need, what other preparation might they need, and really help them think about what's a good fit for them and their family. And then a key idea here is to offer clear next steps for what prospective parents can do to move forward at their pace. So moving forward may mean moving ahead to apply to become a foster family or to get an adoption home study, or it may not be, and their right step might be to pause or to put things on hold or decide it's not the right step for them, but helping them understand how they can move forward at their pace and then on their path is a really helpful way to be engaging and helps build that relationship. So again, there's good word of mouth out in the community to help your recruitment efforts. So a lot of what I've covered so far has really been about steps that you would more commonly take with prospective foster and adoptive families. And we recognize that there are some unique dynamics for relatives and other kinship caregivers who may come to this process quite differently than prospective foster adoptive families. So we want to highlight some specific considerations for how to do that engagement and development and skill building with relatives. So one of the key ideas here that is crucial in working with people who are known to the child, who are relatives or family friends, is really valuing their relationships and their wisdom. They have quite a bit of expertise about their family, likely about the specific child, perhaps about the community where the child lives. So recognizing that they are coming to this interaction with the child welfare system with extensive expertise specific to this child and to the child's birth family can really help set a good tone and be engaging for those adults who are coming as a possible resource for this child. And as is often the case, if we're doing relative searches or otherwise finding possible kinship caregivers, these adults may not have ever considered becoming foster families or adoptive families. They may not have had any thoughts about connecting with the child welfare system. So as they bring their expertise about the child and possibly the birth family, they may need extra information about what is foster care, what is kinship care, how does the child welfare system work, who are all of these different entities involved in the process, what are the requirements. So it's a bit of a dance to help make sure you're really honoring their knowledge and expertise in the areas where they have that, and recognizing that they may not know our terms and the sort of standard questions that you may get from prospective foster adoptive parents. Relatives may also need some specific assistance with how to develop and really get support for navigating some of those unique dynamics that come with kinship care, such as family relationships and how to handle keeping the child safe and supervised appropriately if birth family members are also coming to the house, or how to navigate explaining the relationship to others if people are asking why grandma is caring for her grandson. Navigating the relationship if the caregiver is the parent of this child's birth parent. Some of those situations may require some additional assistance and really helping kinship caregivers think through how will they handle it in the context of their relationships and their family. And it's important to remember that relatives and other kinship caregivers may really want to focus on supporting the specific child or children that they're caring for, for their relatives. They may not be interested in becoming foster family or an adoptive family resource to non-related children. So just keeping in mind, what's the messaging that you're sending to them? What information are you sharing about both opportunities to become a caregiver to non-related children, but also really helping them understand what the options are for them if they are not interested in that broader work, but really want to be just a resource to their relatives. So I've been talking at you for quite a bit here, and as Mary mentioned, we do want this to be interactive. So one of the things that we're looking at is to have you all share some ideas through the chat window. So we're curious to hear, and we'll read some of these out as you share these ideas, but we're curious to hear from all of you in the chat. What other considerations and strategies do you see working for preparing and developing relative caregivers? What are some approaches that you're using or that you've heard of places using to engage and build the skills and knowledge of relatives? So feel free to chat those into the chat window, and we can share those with the group. As we're waiting for your ideas to come in, I'll mention one idea that is common, or I think more common at least around the country, is the idea of having kinship navigators who are really specialized positions to help relatives figure out the process, make it through, understanding the paperwork requirements, understanding the different court hearings and timelines, that really truly a navigator, as the title suggests. So a couple ideas coming in through the chat here. We have a Strengthening Families class. That's great. So really aimed at that family dynamic for relative caregivers. Allowing relatives to attend staffings and court hearings. That's another great one that we've heard about from several child welfare systems to help relatives understand the process and be heard, if possible, both at the individual staffings and at court hearings in front of the judge. We also have Ask the Kinship family if there are other relatives that can assist them with respite or while they attend trainings and meetings. This is a great way of looking at how to really build that support network or help relatives identify their support network that they can tap into as they're taking on this kinship caregiver role. So it's not just them, but it's a broader family system. Another one, relative caregivers are encouraged to attend caregiver core training, which is a pre-service class. So it sounds like a pre-service training for relatives specifically about what are the core issues. We've certainly heard from many places that are looking at specialized pre-service training courses for kinship caregivers that really are looking at more of the specific dynamics in kinship care and how to prepare to care for a specific child. Another idea here is providing them with community resources for additional support. Great suggestion, great idea. Helping connect those kinship caregivers with existing support systems and helping them know how to access them is really helpful, and again, really helps build that relationship. So you're showing that you're wanting them to be supported and successful in meeting the needs of the child. Thank you all for those of you who've submitted ideas here. You can keep having them come in if you'd like, and your colleagues on the webinar can see those. Those are great.
Alicia, I just want to add.
Yep.
I was going to add one consideration that I think is so important with relatives is that sometimes we forget that the tension between relatives can actually be worse than with non-relative caregivers, and so there's really extra support needed for people to get past some of those barriers of with the birth parents. And I just think that that's a consideration that we sometimes forget. We think that relatives, it's going to be easier because they already know the birth parents, but sometimes that knowledge can create added tensions, and people need training and help thinking about how to deal with that, especially if they're working, preparing for reunification.
Such a great point. Thank you, Mary. Thanks for adding that. And I think that really fits with another one of the ideas that came in over the chat about offer family counseling to ensure success. Not to put words in our participants' mouth, I'm not sure if they meant the exact kind of thing that you're talking about, but I think that idea of thinking about if it's family counseling or other forms of support to help relatives navigate those likely more complicated dynamics, and certainly different dynamics than if it were foster families working with unrelated birth families. So thanks for raising that. So again, here we want to hear from you through the chat. As I've mentioned, we recognize that a lot of these ideas and these sort of approaches might need to be adapted to really fit a specific child welfare system in terms of how you're structured, how you approach the work. So we're curious to hear from you your thoughts on how you could apply any of these ideas that I've mentioned in your jurisdiction, in your child welfare system. And are there things that you're thinking about that you would have to adjust to really make them fit? So again, please feel free to share your thoughts in the chat window here, and we can share them with everyone. I think thinking about how to take an idea and really then think about what would implementation look like in your system, given your current structure, given your geographic location, et cetera. It's a really helpful way to move from the broader conceptual ideas to making it a little more concrete.
Alicia, while we wait for people to type, I'll throw one out there, which is just the idea, especially if you have different staff providing that initial response, you can develop talking points, answer to frequently asked questions. Again, they can be, depending on your system, it can be provided on a server where you have, here's all of the information. You can have a database of community resources. So just making sure that even if staff are in different locations or you have multiple staff, they all have the same information that they're sharing with everyone, and that they get together periodically and say, okay, I'm being asked this question, what's our answer? Because I think sometimes that can be difficult when people aren't all in the same place. So particularly in a decentralized model, getting some of that information in writing and getting those teams together on a call or a webinar to share what they're being asked and how they respond could be really helpful.
Yep, that's great. Thanks, Mary. Another idea that I'll share with the group here is, for example, if your response system is contracted out to a private agency, and we saw a significant percentage of respondents on the poll question earlier say that was how your response system is handled. You can think about when it comes time for renewing contracts or doing a new RFP, a request for proposals for bidders for that work, think about what you would want to include in that request for proposals or contract requirements, including things such as having those response system staff use maybe some talking points from the agency, as the talking point idea that Mary just mentioned, or the having a mechanism for the public agency sharing data frequently with the private agency partner on the population of children in care, ages, races, sibling group membership, geographic distribution, but having some structure put into those contracts that really helps empower the private agency partner to follow the kind of response system approach that you want. So it can be, in addition to requirements for how quickly they respond to inquiring parents, you can also include some information about, how you want that response system to work and how you want that to begin developing parents' understanding and connecting them to support. Mary, we got a question through the chat asking, to paraphrase what you said, say it was hard to hear you. I think maybe you were a little bit quiet. Could you chime in again to paraphrase yourself from your earlier comment?
I will, and I'll try to be louder. I don't usually get accused of being quiet, so I hope it's not a technical problem. I just said that if you have staff in different locations, if you have a decentralized approach, it can be great to get people together to develop a list of talking points and answers to frequently asked questions, community resources you can refer people to, so that everyone's giving out the same information. And then I also suggested that you get those people together on a call or a webinar periodically so that they can share ideas with each other and add to the frequently asked questions. So I think it's making sure everyone has the same information can be even more important if you have a decentralized system. And I hope I was louder.
Yeah, thank you. I think that was great. So with that, we're going to hand this over to Mary now to get into some more details on support programs and support strategies. But thank you all for chiming in on the chat discussion here. We're hoping to keep this interactive as we go. So Mary, I will hand it over to you.
Great. Thank you so much, Alicia. And again, I will try to be a little bit louder. As Alicia talked about earlier, the qualities of a response system, I want to talk a little bit about qualities of support services. And by that, I mean services after families have a placement. And I think, these are some of the things that we think are most essential in those ongoing support services. First is trauma-informed and trauma-responsive. And I know I don't need to spend a lot of time on that, given what everybody knows. But I'll just say that you want to make sure that services include an assessment of the child's trauma history, that parents and caregivers and service providers have received training on the short and long-term impact of trauma. Parents know about their own trauma histories and trauma-informed parenting strategies. We really want to make sure that the system isn't increasing trauma as we provide services for children who've suffered neglect, abuse, and trauma. We also want to make sure services are adoption and permanency competent, which means they address the core issues of adoption, loss, grief, rejection, identity, and that providers of support services understand the complexities of adoption and foster care and the importance of permanency in a child's life. When services are child-centered and family-focused, they acknowledge that each child is different, has unique strengths and needs, developmental stages, cultural needs, but they also know that you don't provide services to a child in a vacuum, that a child functions as part of a family system, and the service needs to really see the whole family as part of the solution and part of the treatment and services being received. Next, I'll talk a little bit about services being relationship-based, and this is something we really know is important when families are, particularly when they're struggling, that it's really important to have one point of contact if possible so that they know they can trust the person they're going back to and getting services from, that that person has the knowledge and experience to help them, and that they take the time to build the trust, because we know people aren't always willing to share detailed information, very personal information, until they have a relationship with someone. And this next one is something I'm particularly excited about, in that being strength-based, I think, is so important and so difficult to do when we're in a system that is all about what has gone wrong and the deficits that we have. And so really remembering that we are much more likely to achieve success when we're focusing on strengths. So if a child has a strength or an interest, and that can be used to engage the child in peer support or in activities, and even if family's struggling, let's talk about what they're doing well and build on that for the future. That really knowing that if we focus on the strengths first, we're more likely to be able to both engage the family, which Alicia talked about the importance of that, but also to have success down the road. Of course, have to talk about being culturally responsive. We know there's incredible diversity in the children in foster care, adoption, and kinship care, the children and the families, and that each community may have its own unique needs and strengths, and services need to be responsive to that. And that can include, strategies to be culturally responsive can include recruiting diverse staff and volunteers, ensuring service providers have training on race, culture, and diversity, partnering with particular organizations that have expertise in the communities you serve, and then maybe using translation, interpretation, depending on the needs of your community. And there are other qualities, but the last one I talk about is flexible and accessible. And this sort of can't say enough, and I really mean it in a couple of different ways. One is flexible, meaning that you have an array of services to choose from, because each family, each child has unique needs. One family may really just need a break, and so respite care is going to be the most important thing for them. Another family may have mental health needs and need a support group for themselves and their child. And so having services, access to a variety of services is going to be the best way to meet the needs of the unique children and families we talked about earlier. We also need flexibility in terms of how long services are available. Sometimes support after placement is only available for a few months or a year, and we really know that families often come back for help long after an adoption or a guardianship placement, particularly when children enter their teenage years is a high point when people come back. So having services that are accessible over time and flexible about when families receive services are really important. I'm not going to do too much on this slide, but we know there's an array of support services for foster adoptive kinship families. This is not an extensive or exhaustive list, and I'm going to get into more detail in each of these areas, providing different examples of what different jurisdictions are doing. The goal of this part of the presentation is just to give you ideas of what you might do in your community by hearing what some others are going to do. So this is just, I want to launch a poll right now to see what services your jurisdiction are currently offering to adoptive, foster, and kinship communities. And we have a limited number of choices, so if you can go ahead and check those that apply. And for those, when you have other services you provide, if you put those in the chat window, I'll be able to read out some of those answers. And we know that most of you were providing support after adoption, foster care, kinship placement, which is wonderful. And again, as I said, it looks like we have quite a few of you who are offering other services. So after you hit submit, please put in the chat box the type of services you're offering so I can share those with the group. All right, I'm going to go ahead and close the poll, but feel free to chat about the other offerings you make. Somebody typed in support groups as certainly something that they offer. Training, in-home parent coaching, adoption assistance, critically important one there. Here are the results of the poll. We can see that almost everybody's offering information and referral. Many people are offering peer-to-peer support, and that's where I'd put the parent support groups. And about half, a little more than half, are offering mental health services. The other things we're getting in the chat box are respite, again, sort of material supports, clothing closets, furniture, home studies. Anyway, so an array of services. We're going to talk about many of those things next. Get our slides back up here. So the first thing I want to talk about, I mentioned early on that a trauma-informed system includes starting with an assessment. And I want to talk about the importance of that as a really great starting point for when children enter the system or where they have a change in placement or a change in status. And there are a few programs that do some really interesting assessments, so I want to mention them here. The first is UCLA Ties for Families, which is a program in Los Angeles County, partnering obviously with University of California, Los Angeles. And they do a pretty extensive multidisciplinary assessment. They have clinicians review social service records, legal records, medical records, mental health records, educational records, and evaluate the child's development, strengths, and needs. And they bring together a team of a psychologist, pediatrician, social worker, educational advocate, and others to look at those assessment results and present them in person with prospective families. And they do this once a child is matched with a particular family. And they they make a presentation about the assessment results with the parents and with child welfare worker. And I really like that combination of having the professional there as well, so that they can ask questions, and then the professional knows what the parent knows, and they can start talking about what support services are going to be available down the road. Another entity that does multidisciplinary assessment is the Children's Trauma Assessment Center, which is at Western Michigan University. And they do a very detailed trauma-informed assessment that includes medical exam, screening for fetal alcohol spectrum disorder, assessment of the child's language, attention, processing. They get a history from parents and caregivers. They do interviews with the children, and they talk about, the child's perception of self. They use some different checklists. So it's a really intensive assessment, and they're doing this in many communities across Michigan and working with other jurisdictions in the country. And again, like the youth family, they do a team meeting to discuss internally the results, and then they do a written report for caregivers. And whenever possible, they meet in person with the caregivers, sometimes by phone if it's across the state. And again, they really, in that assessment report, talk about both the in-home and out-of-home services interventions that might help given what they've discovered about the child. And they help educate parents and caregivers about the impact of trauma. So it's also education as well as assessment presentation. Another way to do such an assessment, the Seminole Tribe in Florida, they partner with other agencies within the tribe. They work with the Children's Center for Diagnostics and Therapy and the Education Department to do different assessments of the children that they serve. And so again, they don't have to take it externally to these university partnerships, but they do it within other departments in their community. So that's just one way that assessments can get people started on the right track with knowing what the child's needs are and what support might be needed. The next type of support services I wanted to talk about is navigation, referral, and advocacy. And Alicia already talked about Kinship navigators, and that's often what we think about. And I know most of you said you do information and referrals. I'll just highlight a couple of programs and what they do in this area. Foster Adopt Connect is an agency in Kansas City, Missouri that serves families in Missouri and Kansas. And they have individual family advocates they help families resolve problems and reduce barriers, both sort of with the system and even in their home. And they also help families develop a crisis plan, and they have a family advocate available 24/7. So it's a really nice combination of you're working with an experienced family member, but they're also available to you day or night. They say they don't actually end up needing the crisis service very often, but it's really nice when families need it. Again, the Kinship Navigator program Alicia talked about, there are many of them around the country. There are a couple I wanted to mention. The Children's Home in Florida, they have experienced kinship caregivers, provide peer-to-peer support to caregivers who are just starting the process or after placement. They can help people in the home or by phone. And one of the things I really like about this program is that the navigators have access to a team with particular expertise in education, legal services, substance abuse, public benefits. So the navigators don't have to be experts in everything. They can build that connection with the kin caregivers and turn to their team when they have information they need from someone else. And I also like that, sort of like the program in California that Alicia talked about, is the navigators can, have laptops and web portal where they can help families apply for public benefits. So some of those things that can be daunting for someone who's never been involved in that part of our often complicated system. I want to talk a little bit about the Child Wellbeing Project in Catawba County, North Carolina. That is, they have a success coach model, and it's a voluntary in-home service. One of the things I think is really interesting about it, when they started, it was for any family that was parenting a child who had been in foster care. So whether the child was reunified, in guardianship, or adoption, the same services were available to the family. And these success coaches, they assess the child and family's needs, protective factors, trauma history, and they come up with goals for family functioning, well-being, safety, and then they work with the family to develop a success plan and help coordinate services, and they really help families work on their skills in any of the areas they've they've identified. So it's a really great program to work very closely with families. In terms of advocacy, the top need that we see from families we hear about, or one of the top needs, is certainly on the education side. And so I wanted to highlight that as a particular advocacy model. We know a number of programs have a educational advocate, like Placer County in California has a support services program with staff who can help parents write the individual education plan, the IEP. They can actually go consult with teachers. They can even provide in-classroom support to help with communication and develop problem solving and social skills for the children, actually working with them in the school setting. The Yakima Nation in Washington State partners with their Indian education program to get additional services. So again, they don't have to provide all the services themselves, but what they do is open the doors and help connect the kinship caregivers to existing support services within the education program. And then there's a wonderful program also in Washington State, Treehouse, which is an entire program dedicated to educational support for young people in foster care. And they have educational advocates that work directly with the schools and with social workers and with families and young people to help reduce barriers when children have to change schools. They help families access special education services if they need them. They help young people search for financial aid for college, which is a critically important need for young people in foster care. And they also do trainings on educational needs both for caregivers and social workers to teach them to be their own advocates, which is a wonderful model of spreading the ability of people to advocate for children's educational needs. Another type of ongoing support services that many people offer is training, and that can be done in a number of different ways, and I'll talk about a couple of different ways. One is just periodic training events, and the Adoption Support and Preservation Program in Tennessee, they do pre-adoption training, and they developed their own attachment-based, trauma-informed training. It includes caregiver motivation, parental self-awareness, attachment and resiliency building skills, how to build a support team, grief and loss, race and culture. So families are able to go through that training before they become parents. And then there's Alabama, the Pre-Post Adoption Connection Program offers a number of ongoing training events. They offer monthly webinars for families and professionals across the state. They can do on-site group trainings on adoption topics. They have an annual permanency conference, and they also do training for a therapist network, which was a really wonderful way to increase the adoption competency of the mental health providers in their state. Another, this is a little bit different. Project KEEP is a specialized curriculum that any jurisdiction can use. It's a manualized training for foster families that's been shown to have very promising results, and it's a 16-week program for foster and kinship caregivers, and they bring together groups of about 7 to 10 caregivers for 90 minutes, and again, they have a manual of training, and they learn about behavior management, and they do a lot of discussion. There's homework, and one of the things I really like about this program is that that there's interaction between the sessions. So the facilitator will reach out to each family to talk about any issues the family is facing and brainstorm solutions for them. So again, it's not just training and then you're done. It's training with this ongoing support. And they also are able, if a caregiver is unable to attend, they are often able to receive a home visit where the facilitator can present the information in the home, which is a really great option. The couple other things I want to say about training is there's also UCLA Ties, which I mentioned earlier, which is one of the things they do, which I think is really great, is they add additional training on top of the pre-service training offered in LA County. And they do 9 hours of training on specific issues that may come up. They include the challenges and rewards of parenting children at risk of challenges. They do a lot on the effects of prenatal drug exposure, abuse and neglect, and parental histories of mental illness. They go over parenting strategies, strategies for preventing substance abuse use among the children. So again, what they do is add a layer of additional development on for prospective families. One other training I wanted to mention that I think could be really useful for folks to consider building into their system is a parent resource curriculum developed by the National Child Traumatic Stress Network. It's a 16-hour evidence-informed training for resource parents, and it's a really wonderful training curriculum that covers a lot of the issues coming up for people who are parenting children exposed to trauma. It's being used in a number of states, including Wisconsin, North Carolina, and Michigan. And one of the models I really like, I think they're doing this in Wisconsin, a number of communities, is after they go through the training, they have the parents who went through that training together stay in a support group so they can keep sharing information with each other, supporting one another. And I love that connection between different types of support services. And that I segued myself quite neatly into peer support, which really means young people supporting other young people who are in foster care, adoption, or kinship care, or parents helping one another. And I think this is such a critical support service. I was glad to see that many of you were offering support groups for parents and young people. And there are a number of different ways to do this. We're talking about parent support groups. Some are parent-led, and others are led by therapists or other professionals. I'll talk about a couple of those. In Alabama, the program I was talking about a little while ago, they offer monthly support groups across the state, and they have therapists running those groups, and they also have a separate group for children run by therapists, and then for some of the younger children, they provide childcare. But then on the other side, Adoption Network Cleveland offers groups that are peer-led, and they offer them on different topics. So there's general post-adoption group, a men's support group, transracial family group, and various social activities for adoptive families. They also run groups for adoptees and birth mothers, so they cover the spectrum of the adoption community. I don't want to forget about Facebook or Skype support. We know that for many families, getting together in person can be really difficult. The Adoption Support Network in Minnesota has a number of private, closed Facebook support groups for adoptive families, currently serving about 1,800 families across the state. And it's an extraordinary opportunity for families to ask questions, provide answers, just support each other. And it's really built a community where people have come to become respite providers for one another. They have come together and done food drives or clothing drives for families in need. They've donated furniture to one another. It really has been this kind of amazing, really created a community. And in the tribal support in Minnesota, they also do some Skype support groups. So there's a tribal support parent liaison who lives in the metro area, but she supports tribal members for adoptive parents, foster parents, and kinship parents at other parts of the state. So they do Skype calls once or twice a month. So they get together, they can actually see each other and build that relationship, which is so important. Another element of peer support is parent mentors, and Foster Adopt Connect, the group in Missouri and Kansas I talked about, they have mentors where they have experienced foster adoptive parents engage and guide new parents through their first year after placement. So really helping people in those early days when they may have even more questions. UCLA Ties has parents who've adopted from foster care provide peer support for those who are going through the process and who need additional support. So again, for those families just who are preparing for a placement. We also, of course, have mentors for youth. UCLA Ties, again, they have a wonderful opportunity being a large university that they have young people who are students at the school who were experienced foster care themselves are able to be mentors to children in the program. There are also more formal mentoring programs for young people. Fostering Healthy Futures is one that was developed in Colorado and is being used in several communities there. And it's really a more formal program. It's a 30-week mentoring program that has weekly therapeutic skills training where mentors and facilitators get together and work on particular skill development and anger management, resisting peer pressure. So they work together in these groups on their skills. But they also have 2 to 4 hours of mentoring each week, so quite a bit of mentoring compared to some traditional mentoring models. And their model uses graduate students in social work and psychology, so it's a wonderful opportunity for them to learn about children's needs, but also they become advocates and role models to the children, and they really help them. Their goal is to build the children's connections to the community and engage them in community-based activity, and to keep working on some of those skills they did in the therapeutic group. And again, there are other elements of peer support. I'm sort of going through kind of quickly on these different models of support. Another type of support is enhanced case management. And again, there are a number of programs that really do this. The ones that I'll talk about most are really for families who are struggling. And the first is the Seneca Family of Agencies in California, the Kinship Center. They run a adoption and guardianship wraparound program. And it's a very targeted 18-month program for guardian or adoptive families who are at a risk of disruption or dissolution. And they serve families from around the county who have, where the children are at risk of going into group care. And each family who enters the program is assigned to a family team with a facilitator, a parent partner, a family assistant, and sometimes a youth partner or other community members. And then, like typical sort of case management, they work together to develop resources and solutions. They do an assessment of strengths and needs. They identify goals they want to accomplish, and then they work on that, and they check in, and the case manager follows up with with the family regularly. They meet often. They also offer 24/7 crisis support. So it's really this, again, as I said, it's a wrapper, and it wraps the services around the family and helps them build their own support system for the future when they won't have such intensive engagement. Another model of this is the Illinois Adoption and Guardianship Support Program. And this is a statewide program. It's run by contracted agencies around the state. Most of the services are provided in the family's home by adoption and guardianship competent therapists. It's usually a time-limited program, but it can, for about a year, but it can be extended if need be. And there are a variety of services often offered, but the first is they do a comprehensive assessment, identifying strengths, developing a family treatment plan. They also have crisis intervention. They respond very quickly. They make home visits right away. And then they do the case management and advocacy services, much like the wraparound program I just talked about, where they have workers who can attend meetings and court hearings. They make referrals for outside services, and they can even go with the family to those services if the family wants that support. They also offer specific clinical therapeutic interventions as needed if the family is struggling with particular mental health issues. And they can even do that, again, as I said, in the home, which is a really wonderful thing for a family that's struggling, especially if they have multiple children. It can sometimes be hard to go to all of the different appointments required. Next, I want to talk a little bit about respite care. And again, like the other things I've talked about, there are a variety of ways to provide respite care. And again, this is one that we at Adopt US Kids a number of years ago did a study on barriers and successes to adoption. And respite care came as one of the most important needs that families expressed, and something that's certainly worth considering. And again, there are a variety of ways to offer it. The first one I want to talk about is a more formal program model, and it's the Mockingbird Family Model. It was started also in Washington State, but operates in many communities around the country, including a couple of tribes. They're in Washington, D.C. And what it is it's a constellation. So it's a 6 to 10 adoptive, foster, or kinship care families are brought together in this model. And there's one hub home, which is an experienced foster parent without a current placement. So this is a family who knows what's going on, but doesn't have a child in their home at the moment. And that hub home provides support, a variety of supports to the other families in the constellation. That can be training, it can be peer mentoring and coaching information, and respite. Again, we put it here in the respite section because respite is so important as to what they do and what the families found was needed. But they also do community events, they can do navigation and referral, recreational and cultural activities. So again, it's building a community of support to one another. And I really like the idea of, a parent they're actually paid to do this work. So they're paid for doing this work because we expect parents to support one another so often without any support. And so it's wonderful to see valuing the experience a parent brings and the support that they offer. Another thing people do to provide respite care is special events. And I'll talk about Yakima Nation gets caregivers together for dinner, social events. They're able to get donated tickets to theater shows, NBA basketball games, fairs. They have swimming and skating parties and rodeos. And the caregivers connect with one another and they take a break from caregiving. And they often have young people engaged in the tribe provide support for the young people at the same time. They also have partnered with the local YMCA to offer 3-hour respite events on Saturday evenings. And then a final respite model, and again, we have many more, and Adopt US Kids has a couple of publications on respite care that you can find on our website if you're interested. But another model is a training and referral model. And this is a great one to get families connecting with one another. And so Foster Up Connect does this where they do training of potential respite providers. Then they get a certification that they've been through that training. And then they can make referrals to respite providers who can serve others in the community. And again, those respite providers are other foster, adoptive, and kinship parents. Just a couple more different types of support services I will talk about, and one of them is camps, retreats, and youth activities. And I really want to highlight a couple of different models here. One is family camps, and I'll talk about Alabama's Pre-Post Adoption Connection has a family camp. And one of the things I really love about it is though it's an adoption program, but all the children in the family are able to participate. So it's not just here's where the adopted children go. It's for the birth kids, foster kids, or adopted kids in the family. It's a 4-day summer camp, and it's free for them as long as they've adopted a child from foster care, and has been really a wonderful camp for families in that community. Tennessee, the Adoption Support and Preservation Program offers weekend therapeutic camps that serve the entire adoptive families. They promote attachment, strengthen relationships. They do equine-assisted therapy and recreational activities. So they bring together people for both fun and for learning. Another option along these lines is parent retreats. The Adoption Support Network in Minnesota, which I talked about, has annual retreats for adoptive mothers. They've also done retreats on fetal alcohol spectrum disorder or trauma. And these are 2.5-day retreats that some parents feel life-altering. It is really rejuvenating for them to go back and apply the skills they've learned and just feel refreshed and ready to go again. Tennessee Adoption Support and Preservation hosts an annual respite education support and training retreat. That stands for REST, is the abbreviation. And they, again, learn from each other and have time off at the same time. And obviously, if it's a parent retreat, it doubles as respite, both for the kids and for the parents. And I don't want to forget mentioning youth activities, that it's really great to get young people who are in foster care, adoption, and kinship care together with their peers. Too often, these are children who struggle to have friends and have anyone understand what they are going through or have been through. And having them get together, not necessarily just to talk about what's going on, but just to have fun with other people who know them and feel where they've been can be a wonderful thing. And the Yakima Nation, they do a great partnership. They do a couple of things. They send young people to community events and make it possible for kids to go there. They also partner with the tribe's leadership community to help develop leadership skills and build awareness of their heritage. I do want to, there was a question about the camps, and both the Alabama and Tennessee camps I talked about are for the entire, the Tennessee camps are for the entire adoptive family. The Alabama camps is a kids camp. So there are definitely models that do both, some for kids, some for the whole family. Next, I know this came up when people were typing in the other box that material supports is definitely a support that a number of you provide. And I want to highlight that, particularly in the kinship arena, can be critically important to provide financial support for caregivers who weren't expecting support, and if it's informal kinship care, may not be receiving much support. Washington State has a great program that provides has financial assistance for caregivers to cover all sorts of basic needs: clothing, food, school activities, housing, transportation. Yakima Nation does some very specific, they take in caregivers shopping. They also do some of that financial support provided through the state. And again, many of you mentioned this in the chat. Donated goods, Foster Up Connect has a food pantry. They do clothes, toys, school supplies. One of the things I really like is they partner with some local businesses to do funding for special activities and programs for children. So again, kids can just have fun and be themselves with this if their family can't do it on their own. And I'm going to go a little bit quickly here because we're running out of time. And again, if anybody has questions about anything Alicia or I have brought up, please type them in the chat box. We'll be getting to those shortly. Mental health services are critically important, and I know we did that earlier, that many of you are providing those. Again, different ways to do that. Alabama Pre-Post Adoption Connection has adoption counselors, and they can do short-term, ongoing, or crisis counseling. Tennessee does in-home therapeutic services using a number of evidence-based and promising techniques, including trauma-focused cognitive behavioral therapy, attachment, self-regulation, and competency model, and trust-based relational intervention. And I know a couple of you mentioned that earlier as a service. A TBRI is one that a number of communities are now using. Sierra Forever Families offers and that's a program in California. They offer community-based clinicians who use some of those same treatments, and then plus parent-child interaction therapy. And again, these are all ones that have been used with this population and have some pretty strong evidence behind them. I am going to pause, as Alicia did earlier, and I know I've thrown a lot of information at you, and so if you have been thinking about any of it, do any of you have ideas are there things that you think, oh, I could do that in my community, things you want to do in your community, things that if we encourage you to type in the chat, if there's anything that you can think, oh yeah, that's one I want to know more about, and I think I could do in my community. Oh, if somebody should chat so that I just don't feel bad.
Mary, this is Alicia. I'm wondering if I can jump in here and put you on the spot a little bit. But I know you talked about the value of online, sort of technology-based connections, if it's Facebook groups or Skype forms of support. I'm wondering if you're seeing programs or know of any other specific approaches for how to make support services available in rural communities or in more geographically dispersed communities. If you can say anything more about that, I feel like that's something that comes up a lot, is how can we connect people when they're long driving distances or challenges commuting?
Yeah, I think that's a good question, to which I don't have a great answer. I mean, I'll say a couple of things about that. One is that online Facebook support. There are a number of communities doing webinars now. There are also, sort of live training chats where people sort of get together that way. I think the other thing that, some places have models of regional support, so they might decentralize their support. So there's an adoptive foster parent in a variety of communities. So the support is nearby and understands the particular needs of the community. So one way to do it is, rather than having one full-time support person, you might have 4 different ones in different regions. Might have 4 part-time people in different regions in the community. It looks like I did successfully get people to type some things in. So I know that couple things here. So somebody's looking for evidence-based training for foster adoptive homes. I would say from my research, the Project Keep that I mentioned is one of the few that has a specific, has been looked at by the California Evidence-Based Clearinghouse for Child Welfare, which by the way is a great resource. And that one does have, it's not evidence-based, but it's promising practices. I know that Tennessee considers theirs evidence informed, and they might have information about that. There's also a new federal grant, the National Training and Development Curriculum, which will be developing a new pre-service training with, and it'll have a strong, again, it's a few years out, so I don't want to overpromise, but that will be developing an evidence base about what works. And then, yeah, TBRI is certainly an evidence-based support and has some training components in it. Somebody else is typing in here, Together Facing the Challenge is one that they're rolling out in Wyoming, so I hope that's of use. Other things, it looks like people are definitely interested in adding support groups. Difficulty getting people to groups and trainings. I'll say just a little bit about that. That is a struggle for many people. I think one of the things there is some people have found success when they don't call it a support group. They call it, coffee chat. They call it get together. Start out doing social activities and activities for kids. As long as if you provide childcare, that may make it more likely. But we also know that parents who come to those support groups find them incredibly important, but some people are not going to be able to. But I do think that talking to parents about when is the best option. Obviously, if you can offer support groups at different times, you might have one that we found a couple groups have talked about Sunday afternoon is not a bad time to have a support group. So just trying different ones. Let me try to look at it. Looks like a number of you want to add some camps and retreats, and those are great. And I think those can be really, really impactful for families. So let's see if there's anything else. I think that am I missing anything else? All right. Supports for families as they move out of their jurisdiction, and that is certainly a tricky thing, and it's something that we love. Many of the programs we've looked at do provide services regardless of where a family adopted, and I certainly would encourage any of you who have the ability to consider that, bring that up in your community, because we do know that it's a mobile world and people change, they have to move, and if it's considered a trade-off that those families who move out of your jurisdiction, you can replace those with those who move in. So definitely would encourage folks to consider that. And many of the programs we looked at don't limit it to families who adopted from that jurisdiction. All right, thank you all. I am going to try to move this slide. I want to talk just briefly about connecting development and support. So connecting some of what Alicia was talking about earlier with some of the support after placement. And we think this is really helpful to think about. And as we talked about with support groups and people struggling to get people there, one of the things that we think is a great idea here is to work with, create support groups for parents who are waiting for placement. This is often a time when they're already engaged with your agency. They're anxious for a placement. It's great for them to learn. But one of the things you can do is you can have them have their own while you wait group, or you can invite them to existing parent groups. And if they come to existing parent groups, they are going to build connections. They're going to learn about reality, and they're going to know that other parents are asking for support. So it's not quite as scary for them to ask for support. And the other thing is, if you don't want to bring the groups fully together, you could have joint social activities and potlucks and bring people together that way. And so that might help with the barrier of getting people engaged, because we know before they get a placement, they're really anxious and really interested in doing whatever they can to move forward. Another option to connect development and support is having new parents do respite care for existing newly licensed parents do respite care. And again, you can make those connections yourself, or if you do some way I talked about earlier, bringing them together at social events, they may make their own connections. And again, it really helps the newly licensed parents understand children's needs and understand the need for ongoing support. Similarly, you can have interested or newly licensed prospects volunteer at events. I'd recommend after they do their background check. But again, they're going to see that families get together. They're going to get to see kids in the children's program. And again, it just helps them become part of the community of foster, adoptive, and kinship families in their world. A really, really important one is having parent and youth panels in pre-service training. We all know, I think many of you have probably been at trainings where young people have talked about what it's like to be in foster care adoption and what they wish from their foster parents. And I'd say there's almost nothing more powerful than that, hearing it from someone who's lived it. And the same side, for parents to talk about what they've experienced. Again, they can talk about the value of support, and it puts a face to a person who might be with them in a support group and reduce some of those barriers as well. And Alicia talked about this earlier, the need for feedback loops, and this is really important. So what we can, if you're working with an ongoing support program, you can ask people, oh, what do you wish you learned in pre-service training? And you can talk to parents about what what would have helped them get a placement sooner. I am going to I forgot to do an earlier poll, but I'm going to do a poll now and ask if anybody does do services that serve both prospective and current parents together, sort of the examples I was just talking about. All right, I'm doing that kind of quickly, but it looks like, so people are doing some support groups, training, information, referral. About half of you not doing things together. So that's just something to think about as another possible change you could consider as you move forward. And now I am going to turn it over. If anybody has any more questions for us, and again, don't hang up yet, because after the questions, we will have some other resources to share for you. But please type any questions that you have.
Well, while we're waiting to see if we have any more questions come in, I'm wondering if we should highlight a few of the resources that we have available, including some things that are specifically in this, in your Go to Training Control panel. So as Mary was just mentioning, a lot of the programs with support services, we have a lot more information. She was just really scratching the surface on many of those. And we do have an Adopt US Kids publication called Support Matters, Lessons from the Field on Services for Adoptive, Foster, and Kinship Care Families. And that is available on our website, on the Adopt US Kids website. We have a whole section on family support materials. So there's that publication. There are the respite care publications that Mary mentioned earlier, as well as some other tip sheets and resources on family support services and approaches for doing family support. So we wanted to highlight that as we're pulling those in. And now I think we're going to go to a very brief question and answer period. Tracy, are you going to lead us through that?
Sure. What are some specific ways we can implement the kind of response system that you talked about, Alicia, earlier on?
Oh, that's a great question. Thanks for bringing that into a little more concrete from some of the big picture ideas I was mentioning. I think in terms of thinking about how to really implement response systems that capture some of those elements, or hopefully all of the elements that I was mentioning, a couple things come to mind. One, as Mary mentioned, the idea of having some specific talking points and maybe a list of frequently asked questions for your staff to use as they're talking with prospective parents, people who are inquiring. That's a really concrete way that you can help share specific information with prospective families, have there be that consistency of information being shared across staff, and make sure that it's sort of a thoughtful approach to what kind of information do we want to make sure prospective parents know, and we can even anticipate saying, we often get these kind of questions, or families sometimes find it helpful to learn about X, Y, and Z. So that's one specific step. And getting a little more complex, one thing that really could be helpful is having a really intentional approach to your response system, including, possibly having essentially a practice model for here is our response system, here's what we want it to do, here are our goals and our underlying beliefs about the purpose of our response system. For example, there's often a question in the field about should we be trying to screen in or screen out families at a certain point in the process. And if you don't have that be an intentional stated approach or how your system is going to view the response system, people will just default to their personal style, their own preference or assumptions. So if you can have, even if it's a fairly simple practice model that says, for internal use, this is the purpose of our response system. We want it to engage families. We want it to inform families, whatever those specific objectives are. And then even enumerate what are some of those expected behaviors from staff. So it could be things like you want staff to share relevant data about the children in foster care and the common outcomes or what to expect from the process. You want them to share information about trauma and the impact of trauma on children, what that means for parenting children who've been in foster care. You can have specific tools as part of a practice model to help staff. So it could be those talking points. So I think it's, you can really think about how to have some of those concrete materials. And one other quick thought is that you can have experienced foster, adoptive, and kinship families that have the parents and caregivers be part of your response system. So whether that's contracting with them to help staff all of that, or having them hired as staff, it's a great way to have that be part of those engaging and development kind of approaches. And I see we are right at the end of time here. So very quickly, if I can, I want to highlight, you'll get some additional resources available from Adopt US Kids. Our website has extensive information about our services and supports. So just quickly, I'll mention this. We will have applications opening this summer for the Minority Professional Leadership Development Program. We encourage you to learn more about that and see if that's a way to help build staff leadership skills in your system. We also have another upcoming webinar in June on developing strength-based narratives for public recruitment. So really looking at how to do child-specific narratives in a very good strengths-based way. So please be on the lookout for more information about that. We have our contact information available here in the PowerPoint so that you can be in touch with us. If you go to adoptuskids.org, you can find all of our contact information and resources. And then we did want to just list, again, in the whole PowerPoint here, some additional resources. There is a webinar coming up next week for National Foster Care Month as another initiative of the Children's Bureau on supporting kinship connections. So we think that may be of interest to you as well. We want to thank you all for attending. We know we're racing to the end here. Please do complete the evaluation for this webinar. As soon as we close this session, the evaluation the survey will pop up on your web browser, and we really do value your input and feedback. So please include your responses on that, and we will wrap it up for here. So thank you for attending and for your participation. Have a good afternoon.